Can you see my screen now? Hello, hello. Can you guys hear me? Thumbs up or something?
Yeah.
I can hear you and see you now.
Yes.
Okay.
Yeah.
Things
Yes.
are weird. It doesn't actually like let me communicate with anyone until I start the meeting, and that's when it starts recording. And typically I wouldn't start recording until we were getting into it. So it's just a new thing for us to get used to, is that we have to start the meeting right away. Otherwise I don't get to talk to you. So you didn't hear me say I'll start in a few minutes. I apologize. Just trying to let some folks in because we're still missing about 15 people that were here yesterday. So I'm just trying to give it a few more minutes to let folks in. And Liz, I don't know are you able to kind of monitor that for me since you're here?
Yeah, I was wondering if you could add me on the permissions again, and then I can do that for you.
Thank you. We will try to manage this event. Oh, it's going to show up over here. My bad. Okay, let's add Elizabeth. All right, hopefully that'll let you do that now.
Yep, I've got it. I'll watch the admins.
Thank you. Teams has just been a little slow today, I'm noticing, so not moving as fast as I'd like it to. All right, well, we'll go ahead and get started then, since I have a co-pilot again today. Thank you, Liz, for being here to do that. We're going to go ahead and move right into more of the kind of the structure of what the fidelity review is. If you would like, I can send out some copies of things after with the follow-up on, just like we do a prep letter, we have an example agenda that we give folks to. And so there's a lot of actual moving to a fidelity review to plan. Just before I get too into things, if you have your phone unmuted, please mute. It's hard to try to talk over background noise, and I just want to make sure everyone gets as much from this as possible. Yes, I will. I promise I'll send stuff out. So what this looks like, so if you are going to be the lead reviewer, typically I lead a lot of our reviews. However, we do have about 30 people in what we call the Supportive Housing Lead Cadre. They're lead cadre members, and we have certified them through a 2.5-day training to lead a fidelity review. And so these are some of the things that they would be doing if they were leading a review, or if you were to come in and lead a review. So the first thing is, of course, we send out an agenda, and we give the provider the ability to make that agenda. I have kind of an example one to see how it's structured throughout the day, but then they go and talk to their staff to see when their availability is for things like interviewing, what participants they want to interview, those kinds of things, and when their participants are available. And then they fill out that agenda around interview times, when we're going to review documentation, all of that. And then they send it to me, and we would just make sure it functions and flows good. So part of, leading the review is creating that agenda. And then we also give out a handout called Sources of Information. It's also in our prep letter that we have. And if we have time at the end, I might pull it up, but we'll see what time allows. But Sources of Information are the things that we would look at in a review. So we talked about, we look at documentation, we look at policy and procedure, we look at marketing materials, we look at participant files. Would we include looking at leases, looking at treatment planning or stability plans? We would review documentation. So we'd look at notes. We wouldn't read every single note, but we would definitely read through notes. Usually I look at some of the first notes that they had, some kind of in the middle, and then the last few notes to kind of gauge, is a participant getting choice? Are we seeing participant voice in the documentation? Do they modify their treatment plan? So we'd be looking for more than one stability plan or treatment plan, whatever you want to call them. We'd be looking for those goal plans to make sure that if they change their mind, they were able to update it, and it's not, we're reading some new goals in the documentation, but we're not seeing it in the plan. So we'd look for leases, we'd look for inspections. We're going to look at any releases of information. If you're telling me in interviews that you're coordinating care with a provider for that participant, then I should see a release of information in the provider file. So we're looking for those things. We look for any kind of landlord correspondence, really gauge the different things that are going on with that participant to really get a kind of a full scope of how someone's being served, right? So all those important documents. So that source of information is a big one because it gives you kind of all the things that we would be looking at in a file and outside of a file. The interviewing, we do have question templates that have specific questions around each dimension. You're not required to stick completely to those questions. You can ask clarifying questions. You can ask things that you're curious about as well. It's really okay to go off script with the questions as long as you're taking notes and that they're fidelity related. Part of this is peer-to-peer learning from one another. So if you're a supportive housing specialist and you're interviewing another supportive housing specialist, there might be questions you have just around things you've heard or want to know, you're curious about. Same with leadership. If you're a supervisor and you're getting an interview, maybe the lead of the FCS team at that agency, there might be questions you're interested in hearing about. So you can ask additional questions, but we do give you questions to go off of if you're not sure of what to ask. And there's ones around each dimension. There are also leadership questions are a little bit different than the housing case manager questions. We have ones that are specific to peers, although the peer questions are very similar to the housing specialist. So we do have specific questions. We have a special participant set of questions that we ask participants when we interview them. And so you do have something to go off of. You don't have to just kind of figure it out. We want to make sure you have something to kind of launch off from. We're obviously going to be observing, right? We're going to be seeing how case managers are working. And if we had the opportunity, we had more time, just like the employment fidelity review, we would maybe go out and see how they work with landlords to get housing, things like that. But typically it's observation in the office, seeing where the case managers may be functioning, the leadership. Do they have team meetings? If they have a team meeting, when we're there, we can observe team meetings to see what do they staff, what do they discuss, and things like that. So we can help kind of get that full picture again. We're going to do the consensus scoring. And the part of the great thing about this is no one can put a lot of bias into consensus scoring because everyone has to be on the same page around scoring. So when we come together as a scoring team, we go through each dimension and we talk through the different scores, and we'll talk about scoring in a minute. But then if we can't agree on one score, we have to go down to the next one and talk about the next one until everyone agrees that the score meets what we think where they've come to. And a lot of times we split up interviews. So maybe I'm in an interview with a couple other people over here, and then another group's doing another interview. So we may not be observing everything. And so we have to listen to each other about when we're scoring to say, well, maybe this is a 4, and someone goes, no, they said this and we need to recommend something for them. So, and then we would have to go down to the next score and talk about that until we all agree. And then we do that final report. And I mentioned yesterday that really the report kind of talks about what the review, what we did at the review, who we interviewed. It'll list the review team that was there. And then it really goes through each dimension, and we give out any kind of recommendation. So based on the scoring, the only way you wouldn't get a recommendation on a dimension is if you get a 4. If you get a 4 in fidelity on a dimension, that means you're doing it. You're reaching fidelity in those. And so we would not get a recommendation. However, there are times when we do give some general recommendations overall. And we always try to highlight things that we saw as strengths in the report as well. So it's not just oh my gosh, these are a lot of things we need to work on, but it also gives you a tool to really praise your staff and really champion your staff around some of the great work that they're doing and celebrate that work, because housing's hard, and no matter what, folks need to be acknowledged when they're doing great work, and we should be celebrating all the small wins, even if it's not these big wins. So it's really about the recommendations. That's really the point of fidelity, is to get recommendations to help a program move further into fidelity and reach those kind of key principles. And then we work after a report's written, we send it out to the provider, and the provider would then, we would schedule a meeting with them and go over the report and then create an action plan to improve, or I call it a training plan, not really like an action plan, but it would be steps that we can help get them to that fidelity. So that's one of the big pieces to that. And then of course we have the fidelity scores. You all will get a score in your fidelity review. And I really tell people, again, not to focus on that score. A lot of people are like, we're going to beat last year's, or we're going to beat our other location or whatever. We get that a lot of times. And that's great if you need that kind of that challenge, that's awesome. But really it's about, again, those recommendations we're giving and not to focus so much on the score, because the way Fidelity scored is interesting, and you'll see that in a minute when we get into the scoring part of the program. So again, this is just going over kind of the review of the agenda. So we're gonna kind of put everything in there. And I just realizing that my slides, sometimes I get ahead of myself, so I apologize. So you do have to, we talk, the full day is, the first day is full day. It's really a 9 to probably 4:30 kind of day. We try to pack in most of the Fidelity review in that first day, leaving time obviously for lunch and breaks. And then the second day is, I usually try to do a half day that day. And so whatever we don't get done the first day, we'll come in the next morning and kind of finish up documentation review. Maybe if there's another interview that needed to be rescheduled, we'll just kind of finish all that up. We'll do that Q&A at the end, like I mentioned yesterday, where we'll all come together and ask clarifying questions. And then we have to leave time in for that consensus scoring. I usually give 2 hours for consensus scoring. It does not always take that long. Typically, the team that's reviewed is usually on the same page for the most part. We don't have a lot of like negotiating or debate about things. There is sometimes when we get a lot of debate, but usually we still get through a scoring within the 2 hours, and a lot of times it's much quicker than that. But I do like to leave enough time to be able to have those discussions if we need to, especially when we're splitting up the interviews and things like that. And then what I like to do before my review team leaves for the day, or for that second day, is to, of course, assign parts of the report. So each of us, depending on how many people are on a review, and typically I have a team of 3 to 5, depending, outside of me, depending on the size of the agency or how many people are just really interested in joining that review. Sometimes we have somebody just shadowing that's really, really new. But then I also like to each come up with a recommendation for each dimension before we walk away. And that kind of launches off that report writing. The other thing I like to do before we leave the agency, before we go score, is to kind of just wrap up the day with letting them know something that we thought was a strength of that agency, really leaving them on a good note, feeling positive. Because when you have somebody coming in your agency asking you a bunch of questions, digging through your files, it feels kind of daunting at first if you haven't done a review. It's not an audit. We're not auditing you. We're really looking at your program and just seeing how we can support you in Fidelity, but it still feels kind of that way. If you've never gone through a Fidelity review, you feel a little bit stressed. A lot of times people are nervous about getting interviewed. And so we try to make sure that everyone on the team leaves the agency with some highlights of things they saw while we were there. And that gives you kind of a, we are seeing strengths, we see this great work you're doing, and it leaves that final note on a good note. And then we move into that scoring. And I thought I saw a question pop up, but I want to make sure I'm going to address it really quick. Jump to newest. So it's different than employment. Employment typically like interviews participants all together. We do each interview separately unless there's a leadership team that's there. Typically, if we have like a FCS lead or maybe the executive director, sometimes we'll do the leadership interviews together. Sometimes if we have time and we don't have a lot of case managers interview, we'll do them one-on-one. But yes, we would typically do all of our interviews separately and not as a group. So again, like I and maybe another reviewer would take a case manager to one room, and then 2 other people would take another case manager to another. And so that's how those interviews get done. Support Employment does do some additional group interviews that we do just a little bit differently in PSH. Great question. So this is just kind of a list of all those things that we would maybe be looking at. We want to look at how do you describe your program to the community? Do you have brochures that you use? Do you have a mission statement? I always put the agency's mission statement in their report. I always think it's really interesting to read mission statements and like to highlight those. We're going to look at the organizational structure. So do you have an org chart you can share with us? We're going to look at that just to help understand the kind of dynamics of the team and how that works. I mentioned policy and procedure. We definitely want to look at policy. Those are a lot of the spaces where we find that maybe there is a readiness requirement, or maybe they don't have a disenrollment policy, or what do those things look like? So it's really good for us to be able to review those. Any MOUs or MOAs between agencies are really good for us because, like I mentioned, coordination of care is a big piece of what we do. And if you are having kind of formal partnerships created, those MOUs are really important. And so we'd want to see that and see what that looks like. What does it cover? Does it mean you don't have to have an ROI for that agency, or does it not cover that? So those are things that we would want to look at, because if it's an MOU that does cover that back and forth kind of staffing or coordination, then we wouldn't have to necessarily. But if I don't see that it covers it, then I'm going to expect to see an ROI for that agency still in the file for that participant. Intake procedures, I always ask programs to send me their intake packets or whatever they use to intake. We aren't looking at the FCS assessments. We're not looking at what you send to WellPoint. Those aren't things that we would pay much attention to, because we're really looking at the services side of things. So I'm not worried about looking at how many authorizations somebody had necessarily in this space, although it is interesting to see, if someone's gone through like 10 authorizations, they've been in the program a pretty long time. Are they moving forward in their goals? Those kinds of things that we typically wouldn't pay a lot of attention to, those WellPoint documents like authorization forms. But we do like to look at intakes. Do you have an assessment you do? What are some of the things you have them sign? We talked about participant agreements yesterday. Those are things that we do see in programs. And so we would want to look at all that stuff. I like to look at job descriptions. I don't think that's on here. I don't remember, but I like to look at job descriptions to see kind of the dynamics of the roles, what they're allowed to do, what their duties aren't and are. I don't, eligibility or admission criteria, that probably should come off here, because we already know that if someone's authorized for FCS and that went through WellPoint and they were deemed eligible. So I don't need to see that. We know what our criteria is, or eligibility. If there's a wait list, that's the thing we would want to know. What is it? Why are you, are you capping your program? Do you not have enough staff to serve folks? It's okay to have a wait list. We don't love it, but if you need to have a wait list, then understanding what that wait list looks like in the process to get people off of the list. Discharge procedures. As you know, for FCS, people aren't automatically disenrolled, but we do have a disenrollment policy that says you can disenroll individuals who are not actively engaging or utilizing services. And so one of my questions always is, do you have an inactive caseload versus your active caseload? Are there people that are on your caseload, but you can't reach them, you haven't had contact with them? And then if so, what does that look like to disenroll somebody? What is your process? Do you have a policy around that? Do you have to contact so many times for so long and then it's a letter? What does that look like? So we would be asking some of those questions, especially if you have a lot of inactive folks sitting on caseloads, because currently, it's always been you leave someone open through their authorization. And so if you have a lot of inactive folks, we would want to talk about how to disenroll somebody after you've tried to do the re-engage them process. Do you have team meetings? Looking at notes. If we can observe a team meeting, like I said, we'd love to do that. We don't get to do that all the time, but we would love to. And if there's meeting notes we can look at, that helps us kind of see what is talked about and discussed during team meetings, how you guys work together, what are the things you focus on, what does the supervisions look like, how often do you get supervised individually and as a team. And then any other kind of documentation, like I mentioned yesterday, we might look at maybe I mentioned it today, I can't remember already. Landlord correspondence. Is there things like the landlord, you are going back and forth landlord, I know a lot of people keep financial stuff like Social Security award letters in there. We're not going to necessarily look at some of those. One of the things I don't like seeing, unless you're providing subsidy out there, is I don't like really seeing Social Security copies of Social Security cards in their files, just because there shouldn't be any reason other than if you were administering a subsidy that you would need a Social Security number in a file. All right. The other thing that I don't think is mentioned on here, the provider that is hosting the review would also send us a confidentiality agreement so that I can have my team sign that confidentiality agreement before we go in and start looking at people's files. So that's another piece that we don't want to forget. It's really important that we are signing, that we agree to keep everything confidential, and that we won't be sharing anything out about the review or the participants we talk to. So again, if there's a stability plan, housing plan, goal plan, we're going to look at that. If there's referrals Sometimes I'll look at that. That's not the main piece. I am always sort of interested in where referrals are coming from. If you are taking external referrals, but not every agency in FCS is taking external. So there are agencies that only serve people coming through their door. If you had a fidelity review the year before, we want to see what that score is. Look at the report. Are there recommendations? And I always tend to pull those up anyway, because we save all of those here at HCA, but just kind of looking at, were there things about last year's plan that are still being, becoming something that you still get a recommendation on? The whole service plan thing, listen, if you have somebody that's been served for more than 6 months, they should have at least an updated plan in their file. So that still should be at minimum updated every 6 months, but they should actually be living, breathing documents that you're looking at on a regular basis, and know that our participants are changing their mind often. So those really should be updated in real time. Although some agencies have different policy around that, that's what we would recommend. We look at leases, we look at inspections. If you didn't do the inspection on the unit because maybe it was HUD or maybe it was another voucher administration agency, then we would ask for a copy of that inspection. If you didn't house them, maybe they got housed prior to you working with them, or maybe another agency housed them, maybe they housed themselves, we would still want to ask for a copy of the lease. We want to have that lease in the file so we can advocate on behalf of the participant. Oxford's a great question. Someone asked, what about Oxford houses? So Oxford, anytime you have a participant moving into a space, there should be something on paper, whether it's a house rules, house agreement, whether it's, there really should be something on paper that tells the landlord or tells the participant what they're responsible for and what the landlord's responsible for. Even if it's on a napkin, there should be something in writing always of what they've agreed to and what their responsibility is. So how much they paid for rent when they moved in, those kind of basic things should, even in an Oxford or recovery residents don't have official leases, those would be things we'd still want to see in a file. It doesn't mean they have full rights of tenancy. So if we're looking at dimension around full rights of tenancy, we wouldn't necessarily say everyone, 100% of people have leases because, and then with HQS, good question. If you can do an inspection on the space, great. There are some shared living situations where it's really hard to do that because they're only using a room, or maybe it's kind of weird to go through and do an inspection. You can ask if an inspection's been done. A lot of time Oxford houses do have things like that. Or you can go and just inspect the room that they're renting or going to be staying in. So those are things that do the best you can. You can always document, I was unable to do an HQS because, right? It just means you wouldn't have 100%, having HQS done on them, but you could still potentially go and try to do your best to see if a place would pass an inspection. But also, most long-term vouchers wouldn't pay for Oxford. So it's just a matter of documenting if it was unable to be done. Great question, Kevin. Thank you. Any kind of resident rules, policies around that, those are all things we kind of want to see. We want to see if people are really have full choice. So those are other things that help us understand. We have 10 people in this type of housing and they have so many rules that they don't really have a lot of choice. That is part of our scoring and we need to know those things. So those are things we would ask for. A lot of times I'm like, you told me they're in a set aside. What type of set aside? Do they get any kind of choice and who they live with and what that looks like? So those are questions around some of the housing types as well that we would have to ask some additional questions for. So just to be real with y'all, when we go in and do fidelity reviews, a lot of times we don't see leases for everyone that's housed, right? We're only reviewing 10 charts, but that doesn't mean that if you have 8 people housed, we should see 8 charts, and we do the tally. Same with the inspections. We should see 8 inspections unless it's a situation like Kevin mentioned where maybe it's not possible because of the setting that they're living in. So those are the 2 main documents that we see missing a lot. The other thing I see often, and it's not on here, is not seeing the treatment plan or goal plan being updated regularly. And so, like I said, if someone's been in your program, and this is FCS specific, although HARPS, I think best practice typically is every 6 months you update a stability plan. Same idea. We should be seeing it more than one, and we definitely shouldn't see copy and paste. We should see, things being changed and so forth. A lot of times we do see, and this is not going to surprise anybody, affordability sometimes scores low because it's hard to get people at that 30% or less. And there's different measurements of scoring. So people that pay 30% or less are going to get a 4. People that pay 31 to 40 would get a 3, 41 to 50, they'd get a 2, and then 50 and above, they'd get a 1. And then we would add them all up, divide them by the amount of people that were housed, and that would give us an average score. So the scoring can be really interesting and different in each dimension. Still got folks coming in. Welcome, welcome.
Thank you.
So we do see that being a challenge, but it really is dependent on the agency. But those are kind of the top 3 things that we see could affect a score. The lease is a 1 or 4. Either you have full rights of tenancy with your people, and have legal leases in their name, or you don't. And that's kind of a bummer because there really could be some in between space there. So that can really change a score quite a bit just by those 3 points, right? Same with inspections. It's either you inspections. I think if you see no HQS or HHS, it's a 1. If you're getting, I think it's 75% of HQS you're seeing in a file, that would give you a 2.5. And then if you're seeing all 100% has HQS, then you would get those folks would get a 4, or the program would get a 4. Oh yes, I will email stuff. You'll get all. You're asking. You're careful what you wish for. I got tons of stuff to send you. So yes, just to kind of mention, I am going to be sending a follow-up email with the PowerPoint and a couple other documents. I'll send out the PSH toolkit, so you have that. That has the scoring matrix in it. I have a whole FCS Supportive Housing Fidelity manual. I call it the Fidelity Bible because it really has every step of a review in it. And so it's a great tool to have for your staff at their desk to reference all the things, right? And it really helps you learn to build your program around it because you have all that information at your fingertips. So we'll make sure you get all of it, I promise. I love resourcing people up. All right, interviewing, best practice. So first and foremost, I always say, no matter if you're in a group of everyone having a conversation at fidelity reviews or you're doing an interview, you got to keep that neutral face, that poker face, because I've been in reviews in the early days where somebody saw something and they're like, oh my God, I can't believe I just read that. Or like whatever the case may be, try to stay neutral. We're here. We don't bring in our own bias into this. This is really about reviewing an agency and being mindful of somebody could see that and be really, that could stress someone out to have, oh, why did they make that face? What did they see? So be careful about that neutrality. Make sure you're keeping your neutral face on. Some of us, our faces are really easy to read. You can see everything I'm feeling right in my face. So it's a practice sometimes, right? But it's really important to take notes through the entire thing when they're orienting you to the program in the very beginning, the first couple hours you're there. Everyone should have notebooks. Everyone should be writing notes about what they're hearing. If you're hearing something that you think is really relevant, quote it. If they made a statement, make sure you're putting that down. If you hear something you're really worried about, write that down. All of those things are really important. And in the interviews, of course, we're going to take a lot of notes. One thing I tell people, I know you got a couple of people here asking you questions. Just know that if there's a pause, it's because we're writing notes down, and just understand that we will be taking notes through this interview. And same with participants, I like to let them know right from the beginning. First thing we do when we interview participants, do you know why you were asked to come today? And if they don't, then you explain what you're there for. You introduce yourselves, let them know. We're just going to ask you a few questions about your housing situation and your work, who you're working with here. And if at any point you don't want to continue this, you just let us know. Or if you need a break, just let us know. And also, we are going to be writing notes while we're talking. So just know that we're taking notes so we can remember this later as we're talking through the review. So that gives them a level of comfort, and makes them a little less nervous. So if they really wanted to get up and walk out, that they are more, that's their choice, and we will honor that for them. Fidelity reviews are not really, so I got like cat hair, sorry. Fidelity reviews are not really about training or coaching. So in an interview or when you're talking at the agency, I try to avoid as much coaching or training in that moment. It's really about just reviewing the program. All of those things that you can tell them will go in that report, right? So if you think of something while you're talking to in an interview, you can always write that down. I write down recommendations all the time, just in the interviews for my notes for later. Something that comes up and I'm like, oh, I should write that down. That would be a good recommendation for them, right? They said this thing and I'm thinking this, this process could help, or having a policy could help. So those are things that you can be doing all through the time. We will be, like I said, splitting up review teams for interviews. Most of the time, unless it's a really small agency and we don't have a lot of interviews, then we can typically all do it at one time. Although with participants, I try to avoid having too many people in those interviews, maybe just a couple, so it's not overwhelming. And as you can see, this answered, I can't remember who asked it, but yes, it talks about how we interview folks, one-on-one versus group. So when we're doing this whole thing, the whole time we're looking at what does the team do well? Write that down. Oh my gosh, I love that document. I'm going to ask for it later. As some of you may know, and maybe you don't, a lot of the templates and things and tools that we give out here to FCS providers came from either early days of what used to be prior to FCS, Porch and HARPS programs have used a lot of documents from those really early days. And then we've created some additional templates. Also, I've created a lot of tools, but a lot of times some of them come from other agencies that we went out and I was like, oh my gosh, that's a great form. I would love to be able to share this to the network. Is that okay? And so a lot of times folks will give us great templates or documents that we can share out to the network. And so that's really been wonderful to be able to just see, wow, they created this really cool thing and I want everyone to have it. And most agencies are really generous and share those things out. I've had agencies share with each other their policies. Like, can you send that to me? I'd love that template. What's
Go
that?
lay down.
So a lot of that's
I'll
happening.
get you some water. Go lay down.
Yourself on mute, please. Thank you. Do you have any follow-up questions? So while you're doing this work, if you don't have an opportunity to ask in the moment, write down those questions. I always tell my team when we're out there, like, write down any questions you have, and then we'll ask them in that final Q&A hour. Is there a sense of how you would score? Like, a lot of times I have been doing reviews so much that I can be like, oh, they're definitely not getting a 4 here, right? We'll have to see, but based on what I'm seeing, unless the consensus is something very different, I can kind of gauge. But that doesn't always mean that I'm right, for sure. There's been times when I'm like, whoa, they got a higher score than I expected, because scoring is very interesting, and you'll see that when we talk about it. Is there something else to help support the score? So if you're not seeing something, you're like, I don't think I saw this. Do you guys have that to show us? So asking, like, is there additional documentation that I can look at to help me really understand and make sure that I'm clear about how to score this program? So a lot of times it's something that maybe it wasn't offered to us, but we can always ask. And so there's been lots of times where I'm like, I wonder if they have a policy around this, or I didn't see it in the policy and procedure, but maybe it's just not there yet. What is their workflow for this? I'd love to see that. So anytime you have something like that, make a note or ask in the moment if it's appropriate, and that'll give you some additional things to review to score the review. So again, this is kind of we just talked about this. We're going to be doing all of these things to review. This is just a short list. I'm just going to skip right over that because we've talked about it. So the scoring criteria is interesting, and I'm going to show you the score sheet, part of the score sheet in a little bit, but the scores can range from 1 to 4. Like I mentioned before, there are some that are just 1 or 4, either they're doing it or they're not. And if you have any kind of recommendation, as much as I hate to give 1s, if you have any kind of recommendation around that dimension, you have to give them the 1. You can't give them a 4. Sometimes it's a 1, a 2.5, or a 4. And then there are also ones that are 1, 2, 3, or 4. How that was determined or decided, I was not part of the development of this toolkit. Sometimes it kind of makes me mad about it, just because there's times when I want to be like, this would really be a 2.5 if a 2.5 was an option, but it's not. It's not how the scoring was set up. So we have to stick to the scoring. There is one dimension we score differently than the score sheet has us do. And that's only because of a lot of years of provider feedback. And we had to literally go to SAMHSA. I say the Fidelity gods. We had to go to the Fidelity gods, SAMHSA and Pat Tucker, to ask if we could change how we score something to make it more fair in some ways. And I'll explain that in a minute. A 1 really means you're not implementing it. You're not even trying to implement it. It's not there yet. That's obviously where a bulk of recommendation comes from. And then if it's a 4, like I mentioned, we don't give recommendations on 4. We might say, good job, well done, fantastic work, keep it up, kind of thing. But it means you've met fidelity in that measure. So if you have any recommendations, again, don't give a 4, because this is really not about having the benefit of a doubt. It's really about helping those providers get closer to fidelity. So we want to make sure if we have recommendations, we should be offering that to them. So again, this is all, we have to be together. So if someone is in the review, they have to be at the scoring. We can't do scoring for a review if not all review team is there. So I've had times where I've had to reschedule it or do it later, like virtually, because somebody couldn't be there for the scoring of it. And we need everyone that was in the review to be present to do that consensus scoring. We add all the dimensions up and then we get our score. So the highest score, perfect score for fidelity would be 28. However, because I mentioned yesterday, people have choice and there's some things we don't have control over. I've never given a perfect score, and really, because fidelity can change based on point in time, you could have gotten a really higher score the year before and then come in and see your score go down a little bit based on maybe caseloads because you have some staff challenges, or maybe it's because your housing market's changed, and maybe it's because everyone that you're working with is choosing to go into like Oxford housing. That could change the score drastically. So it really is point in time, and it can fluctuate from year to year or review to review. So you'll get really familiar with this form. This is our fidelity score sheet. It's part of the toolkit. And so this is just a piece of it. This is the first dimension. So it's broken down. 1.1a is tenants have choice of type of housing, right? And you'll know in the matrix what the score is. I'll show you that piece in a minute. 1.1 is real choice in housing unit. And so you just put your score all the way through there, and then you add them up and divide them by the 4 dimensions, and that'll give you your score at the bottom. And it just tells you how to score. It's very easy. This is the kind of math I like. It's really the only kind of math I like. This allows us to get a really accurate score. And so this is a fuller view. And if I realized, I didn't even realize I had a full one. Otherwise I wouldn't have even added the other one. This is the first page, right? This is the first 5 dimensions. 6 and 7 are on a separate sheet. 7's a pretty long one. As we mentioned, 7's got a lot of elements to it, but this is what they look like. And you'll get really familiar with this if you're going to hang out with me and do a review or 2 or 3. And then part of it is the scoring matrix. So as you can see, for choice 1.1a, you get a 1, a 2.5, or a 4, and you can kind of see how it's decided. I will say that this toolkit is pretty out of date. It also was designed for behavioral health specifically. So there are some language things that I would like to see changed because it's just words that we don't really use anymore. And there's also some pieces to this where you will have to do what I call the interpretive dance, because not everyone's a behavioral health organization. And in fact, a huge part of FCS isn't BHOs. So we need to think about how that fits into the scoring. Even if the language specifically in this doesn't match, you kind of know where it will fall based on what you know. So for choice, there isn't really anything. As you can see for like 1.1b, it's either tenants are assigned a unit, like coordinated entry in King County, they are assigned a space, right? You don't get a choice, or they get to choose from multiple units. And so you'll be able to score that based on what you see in documentation and what your participants in the interviews will say. 1.2a is the one where, 1.2a is the one where we had to go and say, listen, I'm getting a lot of pushback about the score. Originally, if you had anyone in an Oxford or recovery residence that had any kind of shared living situation where they don't have choice, the whole thing would be a 1, right? And so, but I had a lot of people that like, I have one person in Oxford and I've got 25 or 30 or 80 other people in scattered site and you're still giving me a 1 for this measure. And I was like, well, it's evidence-based. There's a reason we did that. But after a few years of a lot of feedback about that particular spot in choice, we did go talk to SAMHSA and they now allow us to do something a little bit different. So anyone that's in full scattered site who has choice of control over their composition, those would get a 4. So say you have 20 that get a 4. Maybe you have 5 people in recovery residence or the type of residence that may have some choice. Maybe you do get to choose the room you go into, or maybe you do get to choose who your roommate is. Those folks, maybe it's 5, get that 2.5. And then anyone that goes into Oxford setting where you really don't get choice at all would get a 1. And then we'd do the same thing where we'd add it up, divide it by the amount of people, and that would give us an average score. So typically this would be just a 1, a 2.5, or 4, but now we do an average of that. And that's how we score the 1.2A, which is a little bit different than what's on this score sheet. But that was just to make it seem like it was more fair to the agencies who are housing people where they choose, and not to give them a 1 if they only have one person choosing a setting that doesn't have choice and everyone else is. So after lots of discussion, lots of figuring that out, we came to the conclusion to score it that way. All right. How many faces do you see in this tree? You come off mute, you can throw it in the chat. I'm sure some of you have seen this before.
Many faces.
Many faces in the tree. It's all how you look at it, right?
Yeah.
So perspective, it's a big part of this, right? That's why we have multiple people on the review team. If I just came in and reviewed a program,
13.
Yeah, a lot of people are seeing up to 13 faces, right? That's a lot. And everyone, there's people that only see 9, there's some that see 11. It's all about perspective. So when we're going in, the reason we take a team is so that we can get different perspectives. That's also why we interview all the different positions in the program. That's also why we look at different charts. Those are all reasons to make sure we get the full perspective of what's going on. And each of us comes with our own perspective as well. So that's why we come in and look at all the different pieces of the program, and that we don't have just one person coming in and doing the review, right? And plus it makes it more fun to have a group of people doing it. So I can't imagine going out and doing all those reviews all by myself. But yeah, it's all about perspective. I like to show the slide just because this is really what it's like to go in and be like, okay, well, someone saw 11 faces, someone else saw 13, someone only saw 9, right? So having that perspective, kind of going into that space, getting the whole picture. We want to get as much information as we can. In 2 days, it's not a lot of time, right? So we have to make sure, the agency that's doing the review is doing a lot of prep ahead of time to make sure they have all their ducks in a row. We ask people to send out any stuff that they can ahead of time, like policy, org charts, things that aren't maybe requiring you to send me the file, but those are all things that you could send us ahead of time to start working on reviewing that before the review if we have time, so that we can get a little bit more time to just focus on those charts when we're there in those interviews. So we're going to go through each part of the scoring. Yeah, I'm just keeping track of time here. So like I said, some of them have 1, 2.5, or 4. So choice of housing would either have that 1, 2.5, or 4. Real choice in housing, that's either they do or they don't. So would somebody get to see multiple units or not? Would they get to choose from those units? Would someone be losing their place in line? That's 1 through 4. So you can give them a 1, 2, 3, or 4 there, right? And then we talked about the choice of living arrangements. That's the one that's a little bit funky and doesn't match what we have on here, but it's something I'd just rather explain than have, because it doesn't match the scoring template. Dimension 2 is separation of housing and services. So is this housing provider also providing services? So is the housing manager, is this agency own their own housing, basically? Because there is times when in like permanent supportive housing, single site, there is a little bit of a blur between different roles. And so this is a way to be able to see, what is the landlord's duties versus the person that's providing services. That person providing services having to also do some of that house management or landlord management type stuff. So that's what we look for. And then on the flip of that, does the service provider collect rents, give out evictions, hold keys? We would be looking at that. And then typically those two tend to match a lot. Mostly if you're getting a 1 in the one, you're probably likely to get a 1 in the other. Not always, but a lot of times those are going to be the same score. If it's really clean and easy separation, you can see it. Does the service provider have an office located in housing? So do you have a space where you go into a single site and spend your day seeing people there? Or are you and your staff located at your own office and you go out into the community to see people? And that you're not sitting at a housing unit. That's gonna score a little differently, right? Because if you're in a housing unit, are you away from the landlord? Can the landlord hear your conversation with your participant? Can they see documentation and those things? So you want to make sure that there's clear separation between you and your housing staff if you are an owner of housing as part of your work. Decent, safe, and affordable. The first one's what percent of their income must tenants pay for rent? And this is something I didn't show, but I can send it out. Oh, the dreaded housing log. If you know, you know. We've been using the housing log since the very early days of supportive housing in Washington. I think, and Wanda, you could speak to this. I think you guys went away from using the log. I can't remember because you're in PDAMs now or something.
That's correct.
Yeah. So for a long time, both programs use this dreaded housing log that all I'd hear is complaints about. And when I was in direct service, I hated it too. And sometimes the wrong version gets out to agencies and there's things that are broken in the Excel because it has drop downs. And a lot of times I'll go in and the housing log is not completely filled out. However, that's being worked on. Stay tuned. But really, the housing log is where we log how much someone's paying towards their rent. What type of housing are they going into and how much percentage are they paying towards their rent? If the log is working, if you got the right copy, it'll calculate that for you. Otherwise, you're doing some math or you're asking Google what percent of what is are they paying. But that is a 1 through 4. And so we measure it the way that if, like I said, if someone's paying 30% or less, they get the 4, so on and so forth. Does the housing meet HUD's housing quality standards? So I'm not so worried about it meeting HUD's. I'm more worried, is it being done? Are we doing HQS? Are we having those conversations? Yes, we'd like it to meet HQS or HHS, but sometimes people choose to live in the places that don't meet those, and that's a choice we honor. So when we do informed, we talk about the pros and cons of doing that, but I just want to see that it's being done and conversations are being had around it. Those conversations about how can we advocate for repair? Maybe someone's getting that voucher next week and they need to know that this place is going to pass. Will the landlord fix things? If it's not going to pass, having that conversation with your participant, do they want to live there? Is that something that they can deal with? Are they trying to pay out of pocket or are they trying to use a voucher? Because most vouchers require an inspection right before they'll pay rent. And that one's a 4, a 2.5, or a 1. And like I said, I think the 1 is no, there are no HQSs. 2.5 is 75% have HQS that are housed. And then if you have 100% of house folks with an HQS in their file, that would be a 4. All right, dimension 4, housing integration. Are participants placed in units set aside for individuals with disability? Again, this is going to come off that housing log. You guys are going to tell me we have a drop down. It's like scattered site, subsidized, scattered site, unsubsidized, project-based, Oxford recovery, or I think it says sober living. I'm going to be changing some of that too. Is it a master lease? It's actually, we're calling it global leasing now. So you get these drop downs and anyone that's housed should have a housing type. And based on that, we will be able to say, well, transitional set aside, Oxford and recovery residents are all set aside for a population. A lot of the project-based are set aside for chronic homelessness or mental health diagnoses. So we look at that and we do the percentage of people that are in set aside and then the percentage of people out in scattered site where there isn't that need to show a diagnosis or prove that you're part of a specific population, right? And the percentage should be that you have a small amount, 0 to 25 should be in set aside to meet fidelity. That would be a 4. If you have less, or you have 25% or less in set aside type housing. This is something you may not have a lot of control on because where you live and where you work and where you're housing people can make that or change that very much. There's some that have no recovery residents in their entire county. So you're not going to see that in there, right? I worked in a community that had no PSH, no project-based. So we wouldn't even have that option. And so the higher the percentage of people in scattered site housing out in the community anywhere, the higher your score, right? So it's broken into like 0 to 25% is a 4, 26 to whatever is a 3. I'd have to look at because I don't know the numbers exactly, but you get the point that the more you have in scattered, the better score you're going to receive, or the better score that agency is going to receive. All right, dimension 5, that rights of tenancy. Is there a lease in the tenant's name? Anyone that's housed should have something, right? And we are looking at legal leases here, partly because it should be a standard lease without a bunch of rules and addendums. We are going to say they have a lease even if they have addendums, but the problem is that they should have, this is about full rights of tenancy. So every time someone has an addendum to their lease, it means they don't have full rights anymore. And so if you have a bunch of people with leases, that's great. But if they're all attached to additional addendums outside of like lead paint addendums, but house rules, specific, restrictions, curfews, visiting restrictions that aren't a normal lease visitor restriction. Typically, you can have someone stay with you for like up to 14 days a year, whatever, as long as the landlord knows. Those are pieces that are normal, but those addendums where you have to be, it's like quiet hours at this time, or you have to sign in visitors, or you have a curfew, or all of those additional house rules and building rules, those would take away from the legal lease. It's not legal lease. I'm sorry, your full rights of tenancy. It may be a legal lease, but it has additional rules that take away the rights of a tenant to be able to just come and go and do as they please, right? That's a 1, a 2.5, or a 4. Actually, I actually don't think that's wrong. I think that's a 1 or a 4. Either do or don't. So I need to fix that. My apologies. So those are just examples of rules not on standard leases that you see below. Are they required to do a drug test if there's suspicions? All of those things. Sometimes transitional housing will still have some kind of lease type agreement or whatever, but there's a lot of rules attached to what they're able to do if somebody is suspected to be using on the premises or comes into the building under the influence and things like that, right? So those would be things that take away from someone's legal or full rights of tenancy. All right, dimension 6, is there a readiness criteria? Again, we'll see this in policy. We'll hear things in interviews. Sometimes I go, oh, that sounds like a readiness requirement, right? I'll make a little note. Not sure that they are completely housing first or whatever, right? Sometimes I can see that it's just one person. It's probably something that they decided and it's not a program specific thing. So a lot of times when I hear something from one case manager and don't hear it anywhere else, that's a question I would ask in the Q&A that second day, is like, I heard this thing, is that just like how we function, or is that just a training issue with that one case manager, right? That's a 1, 2, 3, or 4. Are people with barriers to housing prioritized? So again, typically if you're a program that does first come, first serve, everyone's getting served the same, doesn't matter what your housing situation is, you're coming through our door, you're typically going to get a 2.5 there because you're doing first come, first serve. If you're out doing outreach, if you're bringing people into a program, if you're prioritizing somehow, like in your policy, it says we prioritize anyone who has been homeless, living on the streets first before we would serve someone that's at risk. That's priority. So your score would be higher if you're prioritizing on some level than it would be if you were not. Who holds the keys to a unit? I always ask in case there's like, no, we don't have keys. Like, I'm asking a really silly question, which I'm glad it feels silly because we really should be, but we do see a lot of different things happen out in the network and in housing in general. So the question would be like, who can enter the unit without the tenant there? And really it should be no one. We shouldn't be going in unless we're invited in, right? There's a couple different pieces, like invited only in specific, or can enter only in a emergency, can enter but with a previous agreement, and then can go and come and go whenever I want, kind of thing. So we really should be at that 4 where we only go when we're invited in, but there is a spectrum there of things depending on the type of housing you may be working within. If you're project based, there's sometimes rules around health and safety checks and things like that. So that can vary the score based on different policy around that. And the last one, first and foremost, is there a menu of options for types of services someone can choose from? And, that would go on the goal plan. Like, are they writing, is there different, do they get to pick and choose? I decided I want housing, and in that housing, I need to help find housing. I need someone to help me get my ID before that so that I can actually apply for spaces. I really want to get a job so that I can pay for my rent. I need to get connected to rental assistance. And then the second one is really, can a person change their services? Do we see modification in there? We should be seeing multiple service plans. Can a person choose no services? We talked about this yesterday. That's another score. Yes, someone can come and go as they want, and they if they don't want services anymore, is voluntary. We let them go, and that would be what we'd hope to hear, is that no services are an option. Or is it limited? You have to have this many services, or you have to be in services to get housing. So there's a whole spectrum there. If you're at that one where yes, you have to be engaging in services to get housing, or you have to comply with the program to be able to access housing, that would be a 1. And then, of course, if no services are an option, then that would be a 4. Are the services consumer driven? I hate the word consumer, so this is one of those spaces I'm like, please change the language. This is really about, are we seeing participant voice? Are we seeing that they are the ones kind of guiding you? Is there documentation showing quotes of folks? Do you see the voice of that person in their service plans? Do you have a feedback loop that participants have a place or a way to be able to give feedback about the program provisions? Do they have a way to be part of that? I talked about the city council at my old agency, and that gave people real power and ways to be able to have a say in how services are provided or things that can happen within services. So do you have an advisory group where people can give feedback? There's different levels of that. And when you see the toolkit, the score sheet, you'll see that you can see that there's different pieces of how much you believe services are consumer driven or participant driven, right? So a 4 would be, they have full say. It's a peer run org. We do all these things to get voice, or it could be they have no say in the services, and that would be a 1. What does a typical caseload look like? I'd be curious to hear caseloads. I always am curious, but we look at caseload sizes per full-time employee, right? So when we go and interview case managers, we will say, what is your current caseload? And we're not just talking, if that provider does multiple programs and that case manager is splitting their time between FCS and another program, they still have a big caseload, right? So they're still serving 2 programs. I'm not just asking about FCS. We'll figure that out. But I will say, what's your active caseload? And is that everyone you serve across the board? And if they say, I have 35, Kimberly, and I'm like, is that just FCS? No, that's my 2 programs. Okay, my next question is, how many of those are actively engaged with you? And a lot of times people will have an inactive caseload, or there's an agency that calls it something different. But then I say, okay, that helps us understand how many people are kind of not engaging in services. We might talk about a disenrollment policy at that point. But caseload sizes for full-time employees to meet fidelity in supportive housing is 12 to 15 full-time, or 12 to 15 participants on a caseload. That would be fidelity. That would be a 4. They stay within 12 to 15 participants. If it's and then of course the score goes down the higher the caseloads go. There's like ranges, right? And you'll see that in that toolkit. So the next 16 to whatever is a 3, you get the point. And so we really are looking at caseload sizes. We're looking at if they're active or inactive, because that's the opportunity to really talk about how we're making sure folks are graduating from the program. If they're not engaging, maybe disenrolling them from the program, hopefully, and they can always come back. They can always get served again. It's just a matter of keeping our caseloads low, because the idea is that we're providing intensive case management, and it takes a lot to navigate some of the things that we're doing for folks. And so we want to make sure you have time to really serve folks well, and also do the other work to support them, like coordination of care, all those things like we talked about yesterday. Are the services provided by a team? This is that coordination of care. This is really the language in this toolkit really focuses on behavioral health, and working with the behavioral health org to wrap around somebody. I count behavioral health, SUD, primary care, those are all things I'd love to see we're wrapping around somebody, right? So again, we can usually tell, are you staffing weekly with a mental health provider? And you guys are doing this on a regular basis? That looks like we're wrapping around people if you do that with a bunch of different agencies. Do you have regular meetings? Do you, is it really provided by a team, or is one person the sole person that does mental health? So you'll see the language in there is a little bit focused on behavioral health. Again, this was designed for that purpose, but when I'm looking at this as a review, I'm really looking at, are you coordinating care with the people that are also serving this individual? Are we talking to behavioral health? I mean, that's a big piece of what we do in housing and the population we serve is that SUD and behavioral health services. I'm sorry, mental health services. They're both behavioral health. And so we would want to look to see how much of that coordination is happening around those providers. And then again, we talked yesterday, our services provided 24/7. Of course, if they are 24/7 services, you're going to get a 4. If it's not, but it's very flexible, a 3. If you can, it's mostly 8 to 5 with a little bit of flexibility, that could be a 2. And then if there's 0, you work 8 to 5, that's it. Or your agency's open 10 to 7, that's all we do, then that would be a 1. If you have no flexibility in serving folks. All righty. That was fast and furious. Am I talking too fast? I hope not. Let me know if I am. Tell me to slow down. It's 2:05, so I want to stop, and we've got we only got a few more slides left. So let me know if you want to break now or if you just want to power through, because we only have a few left and then we have time for questions. What do you guys think? Do you need a minute? Okay, so there is people that do want to break, so go ahead and take a 5-minute break, and then we'll get back at 2:10 and finish off the rest of the slides. So we'll see you in a few minutes. Thanks, everyone. All right, hopefully most of you are able to come back. A few of you might be taking a few more minutes, and that's okay. We're going to go ahead and keep going through this. Before I moved on, I wanted to pull up the housing log. I don't know, Wanda, if HARP's teams hated this log as much as FCS teams do, but this is still a tool we use for now, and I am working on trying to figure out if it's something we'll continue to use in the future or if we'll try to do something different. But as I mentioned, this is a tool we used to use back in the early days of housing to log our full caseload, so that the whole team had everyone, the caseload at a glance, and it would have things like, do they have a lease? This is actually missing a bunch of, they have a bunch of things hidden here. Hold on just a second. Go off of this for a second. Fix things. So it does have things like I guess it doesn't, the things that they're asking before that are addressed, are they housed or unhoused, things like that in the beginning. And then the part I wanted to show you really is, and some people like this tool still, but most of the time agencies are tracking differently. But the things we're mostly looking at here is housing type, right? And there's stuff missing here too. Like, it's so funny. I don't know what happened to this one. There's housing types. You're looking at these drop downs of the different types of housing, and then if they're housed, you would make sure you mark that. Or if they're not, I know PDAMs. I know. I wish. We're FCS is definitely hoping we can go some direction in that way, where it's much easier to track things and data for the program. So yes, as you know, PDAMs is way better. If you haven't worked with PDAMs, I'm hearing great things about it. And you don't have to use this dreaded log anymore. So this is one of the things that we would ask for. We'd ask for the information on the housing type. And then I just noticed on this one, the amount of rent and all of those things are hidden for some reason. I don't know. Someone was messing with this one, it looks like. But it'll have affordable, it'll have, the percentage of rent, how much they pay for rent, how much is their portion, kind of thing. So that's the log. You don't have to use it unless I'm coming for Fidelity. And even then, most of the time I'll just ask for the information. All right. So then we do all these things. We do the consensus scoring, and now we have a report to write. And so we share that work duty. In the early days, it would just be whoever's the lead. Now we really want folks to understand how to write the report, to be thinking about how they would give recommendations. What are some great ideas you could give an agency to get closer to that dimension? And so each reviewer will be assigned a piece of the report. PDAMs. Wanda, do you want to talk about PDAMs for a minute? Someone just asked what it was. I don't know if Wanda's back. Kevin?
Yeah, I'm back.
Okay.
PDAM stands for Program Data Acquisition, something or other, system or something. But it has a learning curve for sure. But it has forms instead of a Excel log, and it's more, I don't want to say intuitive because it's not. It I'm still not sold on it. I'll put it that way.
Okay. So it does have a learning curve. It's a program that tracks the data, right? Can programs enter their own data in PDAMs? I think I've heard that some are able to do that. I don't know. But it's like almost building like a profile for that person as like on a like almost like a face sheet kind of thing, where they can enter data that HARPS is required to collect for their programming.
Right. In the past, we did not have provider one numbers or other demographics to identify people that were receiving services or subsidies. And so PDAMs is supposed to be the fix for that.
Awesome. Great. So there is different programming happening out there. FCS isn't quite there. We are still trying to figure out the best way to collect different data and things like that. We have a lot already being collected, but there's stuff that we still don't get exactly like we'd like to. So, okay, back to report writing. So you get assigned a dimension or two. And some people, what I'll say is, was there a dimension that you feel really strongly you have lots of good recommendations or lots of things to say, and let the review team kind of choose the dimension or two that they want to write. If they have a lot of like, oh, I wrote a bunch of notes on this, I have a lot of things, then I would say, yeah, you be the one to write that one. Of course, I gather all of the report writing. I put it together, polish it up, make sure it's all cohesive, and then kind of finalize the report and send it out to the provider. It should be solely off the review. So even if you're really familiar with that agency, everything you write on that report should be based off of what you saw in that review. Okay, so making sure off of the notes you've taken, off of those interviews, and off the scoring. And I'm even taking notes during the scoring of like, oh, I might be writing that. I might be writing that part of the report. I should probably write that down so I remember why they wanted to score them lower or higher, right? So it just helps me kind of trigger my memory when I'm writing the report. It should be written thoroughly. So there's been times when I've had somebody write a piece of the report, and I get like 2 sentences, right? Not enough good feedback, right? We need to be able to the whole point of this is to give them some really good feedback to move forward with. So if you're just saying like, you got a 2.5 because you didn't meet fidelity, that's not helpful at all. They need to know why they didn't meet it, explain some of the things that maybe we saw or quotes that we heard. And then you obviously want to give recommendations, and we try to give a few recommendations, unless it's like they're so close and there's just one thing you can do, right? But we want to make sure it's worth the while, because people are really looking to have that piece to help them kind of figure out how to change that so they can get closer to fidelity. So we don't want to leave them with nothing, right? We want to make sure that report's a useful tool for them. And it should be expected to be returned in a timely manner. I, as a lead, typically give my review team about 2 weeks to get me back report writing, so that I can gather it all and try to get that report out to the provider within 3 weeks. That's a really quick turnaround. I know sometimes it used to be I used to try to be done in 2 weeks. You're getting your report in 2 weeks. But because my capacity isn't able to do that, and a lot of times my review team has a lot of stuff going on, obviously, too, I try to make sure that 2 weeks they can give me a draft. If there's more, if I have questions or whatever, it gives us time. But I try to get the report out to providers in 3 weeks if I can. And if I can't, I reach out and let them know it's taking a little longer, it's coming. All right, so that's the report. And if you come from like the employment side, our reports are not like employment reports. They're a lot smaller. Supported employment looks at things much more dimensions than we have in housing, and so their reports tend to be a little bit more intense. And if you see the reports we write now compared to the reports we were writing back in 2011, you see that they've changed drastically since those early days of doing supportive housing, at least on the FCS side. All right, so I talked about that inventory yesterday, about all the evidence-based practices, promising practices. That is the WISPA inventory, and you'll see different best practices around that, and ours is on that list. And then on the other link, which you can click onto, that is our evidence-based practice PSH toolkit. I'm going to send that toolkit out to you as well, but it is there if you are interested in getting some of the things. Because of all the changes with SAMHSA, I did notice there was a couple pieces that were missing last time I was online looking, but I do have them saved on my file because I am a file hoarder and I save everything because you never know when you're going to need it. And this time I was right. We need it because it's not on the SAMHSA website anymore. You can ask my team. I have a lot of file. I keep everything. All right, questions. Is there questions after all of this? We've gone through all the things. I'm going to show you a few forms before we get into saying goodbye. But is there any questions that you have for me today? Quiet today. All right, I'm going to take that as a no. If you think of one, go ahead and let me know. I'm going to just scoot on over to my little files here and show you a few things. Too many questions. Okay, well, great. That means you want to spend more time with me and that you'll likely, want to do a review sometime. Because really, I can talk about fidelity all day long. We can talk about what it looks like, all the things. But until you're in it doing a review, you don't really, it really kind of pulls everything together. So learning about the review is great and understanding the process, but it's really when you get your hands in and get to do it that it really sets things into place and really concretes it for you. So this, oh, that wasn't what I was trying to show you. It's going to come up. This is the scorecard. We just showed that on the slide though, but it's going to pull it up anyway. And this one we had to automatically populate. I mean, we can, it'll score it as we go for us, which is lovely if you're using the virtual score sheet. And in this score sheet, also you have all the justifications for the scores. And then we have our actual piece here, right? So this gives us the opportunity to, we used to use this as a report in our report, right? We would just go right in here. But that has since changed because I want people to have more from these reviews than fits in that box. That wasn't what I was trying to show you. I was trying to show you the thing under that though. This is, when it comes up, this is the manual I was talking about. This is our PSH Fidelity Review Process Manual. And this tool has all the things. I'll go through past here, but it literally walks you through every piece of what PSH is, the philosophy behind doing this, what is fidelity, why do we do fidelity, right? So this talks about each step of the way and really goes into detail for folks to really learn through the process. So I used to just give this to the leads that did the reviewer, the certified training they got certified in. But now when I go to a review, I carry a stack of them, and each person that works in supportive housing on the FCS team gets these. And Wanda, if you would like these at some point to get out to HARPS, I'm more than happy to share. I think it's just really, really helpful. It's also got all the questions. If I'm going to scroll really fast, so look away for a minute. It's got the questions, different question lists in here. And some of the questions are going to be changed just because we did update the questions when we went to this manual, and I don't like all the questions. I don't think all the questions are necessarily fidelity related, and so we're going to probably revamp these questions at some point. But again, you don't have to ask every question. You just have to ask what you need to get to what you're trying to figure out. Right? We even have some questions for, I don't know if I already scrolled past it, and I'm sorry if I'm scrolling fast. I know this makes people feel kind of, you could interview a family member or referral source if you wanted to. A lot of times we don't have enough time because we have some pretty large programs in FCS where I'm having, I have one agency at one of their sites has 26 case managers doing FCS. So that's a lot. I can't interview all of them, so we do a sample. Oh, perfect, Amanda. Great. Yes. Amanda jumped from HARPS to FCS to HARPS again. So yes, you can definitely get copies of all of these things. I will make sure the recording is on our YouTube. So day one is already on the YouTube channel, FCS YouTube channel. I can make sure everyone gets links to the recording. You'll get this document. I will send out the score sheet so you have a physical copy of the score sheet. Trying to think of, and I'll send the prep letter so you guys can see what's on that prep letter for how we get agencies prepped to have a review. So you'll be able to receive all of those things. I will make sure everyone gets them. And I'm glad, Amanda, that you're using this book because it's been super helpful and it's a great tool in a review and outside. Any other questions? All right, if they do come to you and you're just like, oh, I wish I'd asked her that, please feel free to reach out to me. I am happy to meet with folks. I'm happy to talk about this more in depth if that's what you need to do. My email address is right here, or you can, if you're a HARPS person and you don't have my email, you can always contact Miss Wanda. She can get you connected to me if needed. But Wanda's just as of a pro at this as I am. We actually learn this together, I think. So we've been doing this a long time. I actually used to review some of HARPS teams with Wanda back in the early days. And so if you need someone to talk more about fidelity, Wanda's also a great person to chat with. They are out doing reviews all the time in the HARPS programs. And they don't do it. It should look pretty much the same for the most part, except I think some of the HARPS ones are virtual. Maybe all of them are virtual, I'm not sure. All right, well, that is going to sum us up for today. I do have some additional resources. If you don't know about pathways to housing, we have a website that FCS created back in the early days. It's got information on all of our housing programs, FCS Fidelity. It's got some training tools on it that's fantastic. And so always visit the Pathways website. I'm going to get you my YouTube channel right now, a link. I'll put it in the chat. This is the FCS YouTube channel. So this has all of the recordings from the FCS program since probably some 2019, 2020 mostly and up. We record the majority of our trainings, whether it's my team doing them or our national TA that we contract with doing them. There's so much training on housing and employment in there. It's wild. So if you're love training and learning and listening to webinars, there's lots of content in there for you to listen to. And then, like I mentioned, we do have the Pathways to Housing website. I'll get you that link too, just so you have it. And this has all the information about Fidelity in it, as well as so many other things. So please make that a favorite. Yeah, go ahead. Do you have a question, Brianna?
I do, and I'm so sorry. It's a last minute thought. As someone coming from your neighboring agency over at Department of Commerce, something that I've been thinking about is what would your frequency of Fidelity reviewing be? Like, do you do it once a year, once a biennium, random draw? Just because since I do come from your neighboring agency, I don't want to burden grantees or make our shared grantees do similar things more than once if we can help it.
Yeah, so that's a good question. So it's a little bit different depending on the program. I think Wanda, is every other year you do a review on an agency, I think. I could be wrong. That might have changed.
That is correct.
Okay. And hers is in their contract that they are required to participate in Fidelity. FCS, from the beginning of FCS up until just recently, we used to incentivize reviews and actually pay agencies to be reviewed and also be reviewers. That has since gone away because we don't have the dollars or the funding to do that anymore. And we also had plans to move the Fidelity reviews into FCS contracts, which is happening currently. However, we have a large FCS network. And so right now we're doing kind of, we're talking with agencies, getting them on board. We're working on figuring out what the cadence will be because we have over 500 sites in FCS. And so it's not as easy to do every other year because we have so many providers and so many sites with those providers. So we're still trying to figure out what the cadence will look like. I won't do a review in an agency until they've been providing services for at least 6 months. We have to have something to review, and then they can do a follow-up review as soon as 6 months after their first review. But typically it would be like a year later, or for FCS, it is going to look slightly different again, because we're just not sure how we're going to have the capacity to do that many on, every other year cadence like Wanda has been able to do, but we're working that out. So it will be probably a random pull when we do get into the cadence, and so we won't necessarily determine who we're doing a review on. There are times when I have maybe a agency got a performance plan or something from a county or from another funder, and they've asked us to come in and do a review, then we'll do that, and things like that will happen. But currently we're just getting people on board and learning that it is in the contract and kind of going into their contract and those things. And then we're still working on the cadence because of such a large network. And a lot of the states that do this as well, I've learned we have the largest provider network. So we are in a kind of a league of our own in the amount of people or agencies that we're needing to review. I know, Brianna, that in the Office of Apple Health and Homes, they are talking about potentially doing Fidelity on the PSH providers that you guys are funding. So that is conversation that started when Melody Pazalt was there, and they're still working towards that. So definitely connect with Ricky Kaner over in the Office of Apple Health and Homes would be the one to talk to. I think he's kind of leading that charge. If I think they're all in the same positions that they were a while ago, because I know there's been some transition. Great question. Yeah, so never do a review, never ask to have a review done if you haven't at least provided services for 6 months, because we need some stuff to look at. And then you can ask for a follow-up or host a follow-up within that next following 6 months, or within that year, we'd like to do a follow-up to see where you're at and what you've been able to work towards. All right, last chance. Any other questions? We're at 2:30. I would love to be able to give you a half hour to back of your life. And if that's all we got, then you guys are free to go. Thank you so much for joining me for 2 days. I hope that this was helpful. And those of you that are HARPs, I'll make sure Wanda gets the attendance list so that you can get counted for your contract deliverables. And I will send out a follow-up with all the stuffs that I promised, either later today or tomorrow. So thanks for joining me. I appreciate all of you. I promise Fidelity's fun, so please use it as a tool. And if you're interested in joining me on a review, I am looking for review team members and will be continuing to. So if you'd like to get on that list of people I kind of call upon when I need a review, please reach out to me through email and I will add you to the list and see if we can get you scheduled on a review. Thanks everyone and have a great afternoon. Take care.